Good day, everyone. We are the Group 1A of BSN3, and today we will be presenting our research poster entitled Lived Experience of ICU Nurses in Caring for Critically Ill Patients. Together with me are KIRSTEN Joyce ABARRO, YVEANCE G. ACOSTA, Josh Kyle B. ANTENOR CRUZ, ALIANA M. BELLEZA, and yours truly, KAIRA CANAREJO. The purpose of this study is to explore the lived experience of intensive care unit nurses in caring for critically ill patients.
For the methodology, the researchers utilized a qualitative phenomenological research design to explore the lived experiences of ICU nurses in caring for critically ill patients. For the research design, a descriptive phenomenological was utilized in order to delve deeper into the lived experiences of ICU nurses. For the research instrument, semi-structured interview guide that was carefully designed to ensure comprehensive data collection. Part 1 is socio-demographic profile, Part 2 is overarching question, and Part 3 is probing questions. For the participants, 8 Filipino intensive care unit nurses, Filipino registered nurses, male or female, age range between 21 to 50 years old, single or married, degree in Bachelor of Science in Nursing or higher, such as an advanced nursing degree, practices any religious belief, permanently employed as a nurse at a government or non-government hospital in Bacolod City, and at least 2 years of experience in the intensive care unit.
Results and discussion. The average age of the participants is approximately 33 years old. The majority of participants were female, 80%, with the remaining 20% being male. Marital status shows that 62.5 are single, 25% are married, and 12.5 are widowed. Religion indicates that 75% are Roman Catholic, 12.5 are Christian born again, and 12.5 are INI. Educational attainment reveals that all participants hold a bachelor's degree in nursing. On average, participants have accumulated over 3 years of experience working in the ICU. 4 major themes emerge from the participants' data.
Now let's proceed to our themes. For our theme 1, it is committing to critical care. This theme highlights the dedication of ICU nurses in providing quality care to critically ill patients. Participants emphasize their commitment to continuous monitoring, life-sustaining interventions, and delivering compassionate care despite the challenges. Next to our theme is theme 2, communicating with nonverbal patients. This theme explores the unique communication strategies employed by ICU nurses with patients who cannot verbally communicate. Participants describe respecting patient dignity by speaking to them as if they were awake, using alternative methods like writing or sign language, and ensuring patient autonomy by seeking family consent for procedures and upholding their wishes.
The third theme delves into the various challenges ICU nurses encounter. Participants discuss the dynamic nature of their work environment, the limitations of resources, potential conflict with colleagues, managing patient families, and the impact of inadequate salaries. The fourth theme analyzes the coping mechanisms employed by ICU nurses to manage the emotional and physical demands of their work. Participants highlighted the importance of work-life balance, finding motivating factors to continue working in the ICU, and coping with the loss of patients. This study reveals the emotionally charged environment ICU nurses face as they manage life and death situations amid resource constraints. Despite these challenges, they exhibit resilience and commitment to patient care, embodying Dorothea Orem's self-care deficit theory and Gene Watson's theory of human caring. The findings highlight the need for systemic support to address the vulnerability of ICU nurses to burnout and stress, emphasizing the importance of enhancing support mechanisms and professional development to sustain their critical role in healthcare.
For our group simulacrum, we have chosen that ICU nurses can be thought of as the clockwork of this critical system. They are precise, tireless, and vital. ICU nurses are not merely caregivers, but they are the heartbeat and timekeepers of critical care. For the following, these are recommendations for our policymakers to increase funding for hospital resources, improve salaries, and invest in well-being programs. For our nurse supervisors to maintain open communication with administration to quickly address concerns. For our College of Nursing administrators to update curricula to include ICU simulations, stress management, and critical thinking. For our ICU nurses to participate in feedback system to share experiences and suggest improvements. For our guidance counselor to conduct regular mental health assessment for our ICU staff. For our nursing students to develop coping strategies and emotional resilience. For patients and families to understand the challenges nurses face and foster respect and empathy. And last, for our future researchers to investigate the experiences of ICU nurses, especially in the limited resource settings. Thank you so much.